And I think that's the whole thing, is that we need to look at more encompassing definitions of mental health, right? I mean, I often look at mental health as emotional health. It's social health. It's, how we relate to ourselves and how we relate to others, how we're connected to ourselves and how we're connected to others, our stress level and how we're managing our stress level. These are all things that are included in mental health. And, I kind of like wrote down a little bit of a list of like, what are all the daily experiences that we have that are in the realm of mental health, right? Anxiety in all forms, right? How we work with our emotions, stress and the ways we manage stress, the ways we feel connected or disconnected to self and others, how we communicate, how we respond to others, to our environment, to our experiences, how we feel about ourselves, right? How resilient we are in the face of challenge and adversity. All of these are in the realm of mental health. And so it literally is something we're navigating every moment of our lives. And I think that's really important, because we need to start to normalize, that this is an experience we all have. This is something that affects all of us. And so, this isn't just like, oh, well, this person has some mental health challenges. We all have mental health challenges because we're human, right? And that, I think, segues into something that I wanted to kind of tap into today as well is, we talk a lot about psychological safety, right? That's, a big topic now in organizations. I definitely teach about that in some of my speaking. And so, how is mental health and psychological safety related, right? I think, a lot of people talk about like check-ins as an example, right? Mm-hmm. And so like check in with people, check and see how they are, but sometimes if there's not psychological safety, right, you're not going to get an honest answer. You're not going to get that kind of clarity, or it doesn't feel safe enough to check in with yourself. And so, how is that kind of related in terms of, we need to feel safe. We need to feel that psychological safety in order to really be able to share our mental health, to tell people how we're feeling on a daily basis, to feel like it's safe enough even to express that we're not having a good day, or that, we're not feeling happy today, or that we are seeing the world as threatening today. I think it's this really important thing I've seen as well is that, if we haven't acknowledged and owned and looked at our own mental health, then, it's more like we have sympathy, or we have a distance between us and the people that we're trying to hold space for, to allow them to look at their mental health. Whereas, we have to look and say, yeah, exactly like you were saying, that my system's dysregulated, or I've had a hard weekend, or, being vulnerable and honest, really looking at ourselves. It's what creates that space for others to be honest and look at themselves. And I think we forget that, sometimes as leaders, as business owners, as founders, as people who are leading teams, we often want to stand, up and like, we got this, we're good. We're always good. We got it all. No problem. But we don't realize we create this distance, and that does not create psychological safety.